So welcome to our second in our series of changes for the personal outcome measures. We had a webinar a few weeks ago where we talked about the changes in the factors. And then today we're going to talk about some of the changes that we've made in the decision making. This session will be recorded and it will be made available to you in a couple of weeks. I'm sorry, somebody's, okay. So it's 1 o'clock and we're going to start our presentation. Again, you can download the handout anytime that you want. We will try to save time for some questions at the end. It's scheduled to be over at 2:30, and I could possibly stay on for a few minutes after that. We'll see how things are going. And if there are questions that we don't get answered, we will answer those and post them on our website as well. So we will make the recording and the slides available in a couple of weeks. We'll send you an email. All right. So beginning with a discussion about the decision making. Again, I'm sorry, I didn't introduce myself. My name is Kathy Yadimick, and I work for CQL in training and certification. So we have a new personal outcome measures manual that will be available very soon. This is the cover, just so that you know. We're very excited about the changes that we've made, and we've gotten lots of positive feedback from you and from other people about how reorganizing the factors makes good sense to them. So just so you recall, the 5 factors that we've gone from, we used to have myself, my world, my dreams. And now we have my human security, my community, my relationships, my choices, and my goals. Today, we're going to focus on the differences. And if you recall, some of you that were on the call originally, we talked about the differences in the manual and the database and how we wanted to make it be more similar. So the database that we have in the manual will be the same. And so these were just a summary of some of the changes. So as we go through, you'll see that we've changed some of the open-ended questions in the manual to yes/no questions. We've separated out type and frequency. We've made more specificity in terms of list. And we've sometimes moved some of the considerations into the decision-making. All right. And we have added in supports on the scale. So when we did this, we did shift the order of the 21 personal outcome measures. We kept the interview process the same, preserved the intent, and we are going to talk about the changes. And aside from people are connected to natural support networks, the decision-making questions are similar. When I recently did an interview, my decisions were exactly the same as they would have been had I used the decision-making questions that are in the current manual. The one for people are connected to natural supports also stayed the same, but I'll explain the difference in a few minutes. All right, and again, we're doing this primarily for the sake of consistency and clarity. So we'll start at the beginning. I thought about many different ways to do this and decided just starting with number 1 would be the best. So we're going to start with these outcomes that are in my human security. So we're going to start with people are safe. And so the outcome for people are safe, the only real change is that when we did the support question, we have changed it so that we are now using a scale. So in the past, it said based on the answers to these questions are individualized supports in place that facilitate this outcome. We did add at home, at work, and in the community. What we're going to do also now is add, yes, supports are in place. No, but we're developing plans. No, we're aware, but there are no plans. Or no, it's not in place. And we're doing this for a couple of reasons. Primarily, it gives us more data to look at. It also helps you to get credit for and give yourselves credit for when you are aware of something that's going on, you're trying to develop a plan, but you haven't put the supports in place yet. So it's just a way to give yourself recognize the progress that you as an organization are making. The next outcome is people are free from abuse and neglect. We expanded that so that it now is, the questions include questions about exploitation and any other mistreatment. We have added in a decision-making question that says, does the person understand the meaning of abuse, neglect, exploitation, and mistreatment? Again, with the idea that that helps us to know whether or not the outcome is present for the person if they understand the meaning of abuse, neglect, exploitation, and mistreatment. In the additional considerations, we are very specific that if the person continues to feel distress related to an allegation or occurrence of abuse or neglect, the outcome is not present. And if you are unable to determine the person's definition of the outcome is not present. Now, we had lots of discussion about this, and some of the discussion was, isn't that true for all outcomes? And it is, but we thought it was particularly important to note that in this particular outcome, people are free from abuse and neglect, because if people are not aware of what abuse and neglect is, then it may be very difficult for us to determine their definition and determine the outcome as present. People have the best possible health. In this particular one, we moved some of the additional considerations into the decision-making questions. You might recall that in the additional considerations, it talked about devices or equipment such as glasses, hearing aids, and dentures, and were those available and in good repair. And we moved that into an outcome, a decision-making question. We added in a specific question about, is the person receiving health care as recommended for their gender, age, and health risk? And so that would mean that it's just more definitive about following the AMA guidelines for cancer screenings or for other kinds of testing that would be in place. Okay. And the health risk would then take into account things about if somebody has diabetes or cataracts and those kinds of things, and so are they receiving the health care as recommended based on those particular health risks. And then we specifically ask for information about these particular tests, and of course added the last bullet of other. In continuing with people have the best possible health, in the support, we also made some changes. And you will recall probably that in the additional considerations, there was an emphasis on making sure that people were aware of their medical issues and their impact. And if that wasn't true, if they were not aware of their medical issues and their impact, then the outcome was, the support was not present. We moved it into a decision-making question to make sure that people weren't missing that. So again, for clarity. And is the person supported to self-manage their health? And again, that would be based on, it was an additional consideration. We've now moved it into a support question, just to make sure we don't lose that, or that it doesn't look like it carries as much weight because it's an additional consideration, not a support question. People experience continuity and security. So we've always talked about what has the person done to protect themselves or their belongings. We've talked about insurance or burial plans, and this just delineates it again into adding it into the decision-making questions. So has the person done any of these things to protect themselves or their belongings, okay? We removed the question, what changes have occurred for the person over the past 1 to 2 years? Again, remember in the very beginning, we talked about sometimes our decision-making questions didn't have yes or no responses. It will still be important for you to think about as you're making your decisions, what changes have occurred and what were the supports that were in place. But we then changed it to have changes occurred over the past 2 years in any of the following. And I did not list all of the specific areas. There are things about change in where the person lives and who they live with, a change in their work or day activities, and then of course other changes important to the person. So in essence, what we did was change that so that we used to ask a pretty global question. We're now asking specific questions. This helps us to identify, and you as an organization, if you're looking at the data, what are those things that have changed for that person, and what are our systems and our practices that are in place around those. So it gives us some more data. Then we've also asked who was responsible for the change. Was it the person? Was it a guardian? Was it a family member, the provider organization, an employer, or other? And so I've always talked about who's responsible for making the changes in people's lives and looking at who's involved in making those changes. And then we ask the changes, are changes to the following areas expected? And it's the same list as above, just to save time and space on the slide. I didn't add that in. So again, we're really looking at changing what changes have occurred to how changes occurred in these specific areas or others, and then what changes are expected and who's primarily responsible for the decisions. So the decision-making question, again, if you don't have your book in front of you, if the answers to number 2, 3, and 4 are yes, the outcome is present. That means that the changes were to be determined by the person with control similar to that exercised by others, and that they have economic resources to meet their basic needs. That's continuity and security. And so that's what it used to say, and now it says, if the answers to 4.1 and 4.6 are yes, and the change either had no impact, was due to informed personal choice, or planned for to minimize the disruption, the outcome is present. It still is looking at economic resources and control similar to that exercised by others. So 4.1 is economic resources, 4.6 is control similar to that exercised by others. And so what changes have occurred and what is the impact on the person's life. For people exercise rights, we took a list of the rights, and I wanted just to credit that we got those from the United Nations Declaration of Human Rights and the UN Convention on the Rights of Persons with Disabilities, and then other legislation and regulations as well. And so we have a list of rights. And for each of those list of rights, we're identifying whether the person exercises those rights. Of course, the list is not all inclusive. You know as well as I do that if we sat down and we listed every right that we have, that we could go on and on and on. And so they are not, all of the rights could not possibly be listed in this manual. And so it's not all inclusive, and there might be other rights that are important to the person, or rights limitations or restrictions to rights not included on that list. Okay. Then you're going to identify who most limits each right that the person does not exercise. It might be by personal choice, it might be imposed by the guardian, it might be imposed by the provider organization, or there might be other things that limits that right. And then for each right, you'll identify whether or not there was adequate due process. Okay, so moving along, we have added to the manual, and again, you'll get this in the PowerPoints when they're emailed. The link is emailed to you, and it is a description of what we're looking for when we talk about adequate due process procedures. They mirror very much the home and community-based waiver settings rule. It mirrors very much what providers of ICFDD services have been doing, and then it also just mirrors best practices within the United States and other countries as well. So this list will be available to you as well in the manual and in this PowerPoint presentation. Okay, so moving from people exercise rights, and we all know there's a lot of overlap between people exercise rights and people are treated fairly. So one of the things that's in the current manual is it says what rights limitations or fair treatment issues have been identified by the person. The next line actually says, if none, the outcome is present. Well, what we find is sometimes that people don't identify rights limitations or fair treatment issues because they either don't know their rights or they've come to accept that that's just how it is, particularly with those standard practices. Actually, had an interview last week where I was surprised to see that we were still locking toothpaste up for people's safety. And so the person has lived in this home for years and years and years and become accustomed to his toothpaste being locked up, so really may not be aware that it's a rights limitation or a fair treatment issue. So what we've done is take off that been identified by the person and have they just been identified by anybody. So it might be the person, it might be in follow-up you learn about them, it might be in other ways that you learn about what rights limitations or fair treatment issues are in place for this person. So then when we're looking at limitations, was adequate due process provided? We've separated that now into two questions. And so we're really looking at, for each rights limitation identified in people exercise rights, the outcome right before this, and any other rights limitations, we're looking for adequate due process. And then for any fair treatment issue, we're really looking at whether or not the issue was addressed so that the person's concerns were resolved. All right, so again, we separated that out because there was sometimes confusion around what was adequate due process for a fair treatment issue. Okay. All right. The last outcome in this particular factor, my human security, is people are respected. And because of the globalness of this particular outcome, we are asking that you not make any decisions about this outcome and these supports until you get finished with the other 20 outcomes. So we're going to talk about it here, but when you're doing your decision making, you're going to go back and look at everything that you've looked at to see if there are any concerns around around the questions, around the other outcomes. All right. So in looking at people are respected, the first question is, how is the person treated by others? Again, it's a very global, open-ended question. And what we want to do is to narrow it down so that there's yes, no responses. So is the person treated with respect by members of their family? Are they treated with respect by the people who work with them at their home, at day or at work? Are they respected by people that they work with, by medical professions if they're in school, or by classmates, by business community members, neighbors, or other people in the community, therapists, counselors? And so again, this gives us some areas around where the data is. I also know that it's very hard sometimes for agencies when they work really hard to make sure that their staff are doing the things that they need to do to treat people, not just with little r respect, where they're polite, but with the big R respect, and they're listening, and they're making sure people have meaningful and things to engage in, and that we're responsive to them. But we're looking at, in general, in the whole world, are they respected? Okay. So this just makes sure that you stay focused on that. And then you can look at where, for your agency, you can look at where the gaps are, and maybe that might help you with what are the changes that we can make. All right. So that finishes the outcomes for the first factor, which happens always to be the longest one. It was before. And so now we'll move into my community that's a little shorter, and talk about those. So in people live in integrated environments, the question right now is, does the person use the same environments used by people in the community for living, work, school, leisure, places of work, worship? And so in essence, we've just, it really stays pretty much the same, except that in the database, you'll know that you're marking for living, work, school, community, and then we've added some ideas around what community is in terms of banking, shopping, leisure, places of worship, etc. Okay. Interact with other members of the community. So most of the time, the type and frequency questions were one question, and now typically they're two. So in this one, we ask, is the type of contact that the person has with other members of the community, is the type satisfactory? And we also ask then, is the frequency satisfactory? Okay, so that's really the change here. And that's in most of the type and frequency questions. Again, I'm not going over where I talked at the very beginning about people are safe, and that support question is throughout. I just didn't repeat it each time. People participate in the life of the community. Again, there are some questions that cause us to look at what we know, but they aren't yes or no questions. And so in the end, people participate in the life of the community. One of those is, what does the person do when participating in the community? How often do they participate? And those questions will be eliminated, and the replacement question will result in a yes/no response. So does the person participate in the life of the community? It will certainly be important for you to know as you're gathering information and as you're making decisions about what the person does, how often they do it, and do they still have the opportunity to refuse. So it doesn't change anything about what you're doing. It just makes the decision-making questions a little clearer. Okay, so then that finishes, and we're moving along quite nicely. We may have more time for questions than I anticipated. So the next factor is my relationships. And so these 5 outcomes are in my relationships. And so we'll start with people are connected to natural support networks. And this is where I believe that you could possibly run into a situation where you will make a decision that's different than how you made a decision last week. So when we talk about natural circumstances, it used to say if the person has no natural support network with which to be connected, then the outcome is present. We've changed it, and so the new one says if the person has no natural support network and they don't want a relationship with a natural support network, then the outcome is present. So this is making it be more around, it is possible that I have no living relatives, but I perhaps have close relationships that could be nurtured into a natural support network. And if I want that, then it's important for me to be able to have that. So this is where in the past, if I met someone and I talked to somebody who told me that all of their parents, their brothers, sisters, they had no living relatives, the outcome was present for them. And now I would have to explore that more and talk about, is there someone you'd like to be a part of your natural support network? Is there, and explore that with them around whether or not they have a desire to have somebody in their life who's family-like, or a close friend who also meets this definition of natural support. Okay. I also talked in this particular one, the natural support network. There are some changes in the additional considerations, and in the additional considerations that you'll have to look at your handout when you get it, is around, we really have, we've added in that a definition of natural support networks that says that natural supports are typically people who have a lasting commitment and or connection to each other, and it's not a casual support like a neighbor or a coworker. So that we're looking at natural support networks, not the way that everyone that it looks at in terms of, when we talk about employment, a lot of times you're looking for someone to provide some supports in that environment in a more natural way than having a job coach coming in. This is really about that lasting and long commitment to people. It also is about, when we look at supports, we've added in a question around the organization recognizing and promoting opportunities for people to develop natural support networks. So it's getting credit and being able to look at those emerging supports, particularly if there are people who have had no natural support network and do want to have a connection with somebody. All right. People have friends. Again, it's we've separated the satisfaction into two questions. We've added, wherever personal choice was in the old manual, we've added informed. That's how we always interpreted it. That's how we always taught it. But we're really looking at making sure it's informed personal choice. So we have those discussions about somebody who doesn't want to go to the dentist. It has to be based on the information that they've had about the impact that that will have on their life. Okay, so we've added informed to personal choice. So in relationship to this particular one, people have friends. If people haven't had the experience of having a friend, it would be very difficult for them to know whether or not they wanted to have a friend or not. We added some changes into the supports to include, again, like I said before, and I didn't add those, so it's possible that you have a yes and a no that is between developing plans, aware, but no plans and not in place. Again, just felt like it was a good time to mention that again, that will be in each one of them. In intimate relationships, actually in this one we kept type and scope as one question. And the reason why we did that primarily was because we wanted to make sure that it was focused on the type of intimate relationship, that it was based on what the person wanted in terms of that relationship. We still will be looking at whether or not people are satisfied with the type and scope and the frequency of their involvement with the person with whom they have an intimate relationship. Okay. Decide when to share personal information. So we have added the question specifically, does the person know what personal information the provider organization has collected about them? So do they know about their record? We've included a list of information the person might be concerned about protecting. ranging from basic personal information. I actually interviewed somebody probably close to a year ago, and they didn't want people to know their weight. They went to a day program and they just didn't really feel like anybody there needed to know their weight. It might be around services and supports. And again, we're looking at this as a way for us to collect data, for you to collect data for your organization, to think about what are those areas of sensitivity for people and how do we better ask these questions. And people perform different social roles. Right now we ask what social roles does the person fill. To have a yes/no response, we ask whether or not the person has a social role or social roles. Are the number and type of social roles satisfactory? And we have, is the person satisfied with the type of social roles they have? And that includes the number of social roles that they have. And we continue to ask about people having a variety of social roles. Moving along to my choices in the personal outcome measures in this particular factor area. These are really around 3 of the primary choice goals. Outcomes: people choose where and with whom to live, people choose where they work, and people choose services. So we've added in to the options include generic community settings and the possibility of a private room or home. So that would include generic settings for home, for work, for a day program, and then the possibility of a private room or home would, of course, be at home. This is influenced some by the home and community settings rule that, for those of you that have not heard, CMS has decided to roll back the deadline, and it's not going to be in place for 5 more years that you have to be in compliance. And so, but we think that it's really important to be looking at these things now because it's also the right things to do. This hasn't changed because we always talked about the array of services that include settings for people with and without disabilities. In the supports, again, we added in a question about whether or not the organization is providing an array of options that include generic options. Now, that doesn't mean that the organization has to offer that service, but they still need to make sure the person has the opportunity to look at an array of options that might even be outside of the scope of what they do. Okay. People choose where to work. This particular question is for information only. It is not meant to, it is an important piece of the data that we do. So we want to know what the person does for work and or other daytime activities and whether they're engaged full or part-time. If you are not collecting this data for your agency or you're not putting it into the database, you wouldn't necessarily need to ask that question. And the same is true for the outcome and support, making sure that people have generic community and work activities for people to do. People choose services. We included examples of services, and so there'll be the question instead of do people choose services, it will be, do people choose services, residential, day, employment, health, and generic. Okay. And as the person, we've added in a question specifically about direct support professionals or staff, thinking that, again, this is really fitting in with the self-direction that people have asked us for. And it's always been something we've talked about here, with whether or not people have a choice about who supports them in their home, at work, or in the community. Okay. People choose personal goals. And so in this one, there are just simple changes. So I'm just going to talk about numbering here. And so the numbering has been set up to match what's in the database. So outcome questions are a numeral, like so for the first outcome question, decision-making question under goals, choose personal goals, it's going to be 20.1. For support questions, it's going to be the numeral and the letter. So the first question under support questions are 20.A, all right? And that's, again, just to make sure it matches the database. There are absolutely no changes for this outcome other than the ones that I've talked about with numbering and the support question. Okay, so again, your current manuals are dated but not outdated. You can keep them. The handout will have the list of the decision-making questions, and those decision-making questions will be available for you. Continuing to think about what's next. So we're continuing on this journey together. The portal, the database called Portal, is new, and it began on May the 1st. The outcome manual will be available soon, and portions of it will be made available electronically to agencies who are accredited or who have certified interviewers or trainers. And we're still working to revise all of the personal outcome measure learning materials, and we'll make those changes in the workshop and reliability assessment soon. Those of you that are going through reliability and training, please don't worry about that. That's a conversation we'll have individually with each organizations.